Dr. Nazari, in terms of like taking X-rays and seeing what's going on in a person's mouth, there's a new thing out there called the cone beam machine. It's basically giving three-dimensional pictures, just the way we make cars and everything else today. We see it in 3 dimension before. I hear you have such a thing, and tell us about it, and tell us, specifically, not so much the technical aspect of it, but, tell us what it really does for the patient because of what it does to the dentist.
Well, as you know, up to a few years ago, the X-rays that we were taking from human overall were 2-dimensional, but we are 3-dimensional objects. So it would depend to the knowledge, to the expertise of the surgeon to perform any kind of surgery which is needed for the patient. These days, with the advent of the 3-dimensional cone machines, you can have a better survey of the area that you wanna that the doctor wants to observe and render their diagnosis and then the treatment. For example, if you want to place an implant in the patient, we used to have only 2-dimensional X-rays from that area, and sometimes you have to actually do the surgery, open the gum, and to see that how much of bone and what kind of quality of bone you have. But with these the new CAT scan machines, 3-dimensional CAT scan machines, you don't need that surgery anymore, and it's a very, very helpful the diagnostic aid for the doctor or the surgeon.
Well, it looks to me it's a good thing to the patient if he doesn't need a surgery.
Definitely.
To eliminate one surgery, that sounds like a good thing to me.
Not only that, these cone machines, they are digital. It means that much lower radiation to the patient. So it will not be harming the patient as the regular conventional radio or X-ray machines. For example, if we even use it in orthodontics too, if you want to survey the bone of the patient, what kind of bone they have and where the teeth are, and then how they're going to be erupting, then also that if the patient has some impacted or the teeth which are inside the bone, what location they exactly are, that the X-ray helps the orthodontist to provide a proper treatment for the patient that cuts down on the length of the treatment. They exactly know where the teeth are and how to go after and treat the orthodontic case much faster and easier.
Wow.
Dragging some of these cases for like 4 or 5 years.
So technology didn't bypass dentistry. That's a nice thing to hear.
Not at all.
Not at all, huh? Not at all. That's wonderful. Well, especially for some reason, most of us, have a little bit of apprehension to go to a dentist, more so than to a physician. And as we mentioned, people make joke of root canals being the worst thing, and every person who has a toothache, he thinks that's much worse than losing his leg, and all those type of stuff. True or not, that's the perception. So I think anything which can make the visit shorter, faster, better, less surgery, and then the work more correct and better, that's a good thing. That's a good thing.
Absolutely. We need to take advantage of the technology that we have in order to provide a proper and also expedient treatment to our patients.
Right. Yeah, well, definitely, less radiation and on top of it, seeing much more, because I can visualize a 3-dimensional being so much better. In the old days in engineering, we used to draw with ink and pencil and linears and triangles. We used to try to draw everything we have 3-dimensional basically to imagine it. And of course these days that goes a lot easier, and now you can just see what's there completely 3-dimensional. So whether you have space, whether not, where to place the implant. Absolutely wonderful. Thanks a lot.
Thank you.